Welcome back. Today we will be discussing cancer-related fatigue, which is one of the first and most common side effects for patients undergoing cancer treatment. When we think of cancer-related fatigue, it really is a tiredness or a fatigue that does not dissipate or disappear with rest. These patients find it incredibly debilitating, and what we see is that the more tired they are from the treatments, the less they do. The less they do, the more they decondition, and the weaker their bodies get to undergo these really difficult and harsh treatments such as chemo and radiation. One of the best and most effective treatment strategies for fatigue, believe it or not, is exercise. The research is quite clear, and since 2010, there's been a 281% increase in literature and studies discussing the efficacy of exercise in cancer. That's over 900 randomized controlled trials that indicate strong, good evidence for the efficacy of exercise in cancer. I will be discussing exercise for patients who are currently undergoing treatment, but I feel it's important to mention that as a preventative strategy, exercise can help minimize your risk for 7 types of cancer: bladder cancer, endometrial cancer, colon cancer, kidney cancer, stomach cancer, esophageal cancer, and breast cancer. Exercise for patients who are currently undergoing cancer treatment has been shown to improve fatigue. It's one of the most important tools to actually fight and combat this cancer-related fatigue. It also reduces anxiety. It reduces depression. It improves your quality of life, improves your physical function, and it's been linked to not exacerbating lymphedema. According to the American Cancer Society guidelines, cancer survivors should engage in regular physical activity, avoid inactivity, and should return to the activities of daily living as soon as possible after being diagnosed. It has been recommended that patients should do 150 minutes of moderate aerobic exercise a week, like walking, and 2 days of strength training. I would recommend doing your strength training with a registered physiotherapist who can help monitor and guide you through this process. If you are not yet there where you can do a full half an hour of walking, you could start by breaking it down into smaller sessions, like 10 minutes 3 times a day, or even 5 minutes 6 times a day. But the moral of the story is to start somewhere, to start low and progress slow. Make sure that whatever you will be doing is something that you enjoy and that it works for you. Whether it's walking outside in a natural environment for 20 to 30 minutes, or whether it's static or slow stretches to some soft music, anything is better than nothing. And remember, break it up if you're not quite there just yet. I want to give you some tips to conserve your physical energy. Firstly, I want you to make sure that you get plenty of rest, even if it's necessary to take frequent naps throughout the day. Make sure that you limit your activities of daily living and that you prioritize the ones that are most important, like your self-care, showering, and dressing. Don't be afraid to ask your family or loved ones for help with tasks that really drain your energy, like grocery shopping or even cooking. Make sure that you eat a well-balanced diet. Often, patients who are on chemo or radiation struggle with constipation or diarrhea or even vomiting, and naturally this will also influence your fatigue levels. Seeing as though nutrition is not in my scope of practice, I like to refer to a registered dietitian who also works in oncology so that they can really formulate a meal plan that works for you and the current treatments and side effects that you are currently experiencing. When you are moving from one position to another, make sure that you do this slowly so that you prevent dizziness and possible falls. Lastly, try and still engage in activities, even if you have to break them down into smaller tasks, but do things that you enjoy. Know that this fatigue will get better as you start becoming more active. I hope that this has encouraged you. Please share this with someone who might benefit. If you like this video, please push the like button, consider subscribing for more videos, and push the bell for a notification for my next video. The next topic that I'll discuss is lymphedema. I will be telling you what it is and what you can do at home. See you then!